Hi, congratulations on your new XDR sensor. Even though your staff may be familiar with digital sensors, it's always a good idea to review sensor care procedures so everyone's on the same page. With proper care, your sensor can provide quality radiographs for several years. So here are some precautions we recommend. When taking the sensor out of its case, never pull on the cable to take the sensor out. Always hold the USB connector and gently unwind the cable until the entire cable is out of the case. Then firmly hold the sensor plate and take the sensor plate out of the sensor plate housing. Be sure to read the card that's in the case because it contains important information regarding your sensor. Always hold the sensor by the USB connector when plugging or unplugging the sensor into a USB port on a computer or a powered hub. Remember to watch for static discharge when handling your sensor. Static electricity strong enough to shock people is a danger to your sensor. Avoid shock to the sensor, such as dropping the sensor on hard surfaces. Although the sensor is made to be reasonably sturdy, letting the sensor hit hard surfaces can shorten its life. When handling the sensor, always avoid kinking or twisting the cable. Sensor holders are great tools. Not only do they help with position and alignment of the sensor in respect to the teeth, jaws, and X-ray unit, but they also help with protecting the sensor. So using a sensor holder is always a great idea. Be aware of what side of the cable you're standing on before you put it in someone's mouth. Believe me, having the sensor cable out of your walkway will help protect your sensor, make things easier for you, and possibly save you some embarrassment. When the sensor plate is in a holder, avoid holding the sensor where the cable and sensor plate meet. Holding the sensor in that area repeatedly puts unnecessary stress on the cable and sensor plate connection. Instead, hold the actual holder. It's safer for your sensor and gives you more control over your sensor placement. Avoid sensor positioning that invites biting on the cable. When you want the patient to close down, try not to use the word bite. Instead, instruct the patient to slowly close and not bite on the sensor cable. Having the patient go into a crossbite or moving the cable to the midline can reduce the chances of your patient biting on your cable. Be sure to take extra care with occlusal radiographs. The sensor is built to last for several years, but there's no point in putting more stress on the cable than is needed. So never tug on your cable to take the barrier off. Always let the barrier slide off or tear the barrier along the seam and take your sensor out that way. To help prevent cross-contamination, the sensor should be disinfected according to the ADA and CDC's recommendations on heat-sensitive equipment. The manufacturer recommends wiping the sensor with an intermediate-level hospital-grade disinfectant. The sensor plate itself is waterproof, but never ever expose the USB connector to any liquids. Store the sensor on 2 hooks 12 inches apart when the sensor is not in use. This will reduce the chances of creating any twists, kinks, or bends in the cable. Alternatively, you can use commercially made sensor wall hangers from a dental supply company. If your dental staff is new to using digital sensors, protect your investment by providing training for your staff and having a protection plan for your sensors. I hope this video provided you some useful tips on how to care for your XDR sensor. If you have any questions regarding your sensor, please remember we are only a phone call away, and all of us here at XDR are always happy to take your phone call. So from our XDR staff to yours, we thank you.